Communities in Hammanskraal, north of Pretoria and surrounding areas are being urged to refrain from drinking tap water following a diarrheal disease outbreak in the area that has killed at least 7 people. At least 67 others have been treated at Jubilee District Hospital. City of Tshwane spokesperson Selby Bokaba says the city regularly conducts tests on water, and following the outbreak, comprehensive tests will be done on the entire water distribution network. Now, test results are expected on Wednesday to determine the cause of the outbreak. Some of the cases reported are from the Moretele area, which is not supplied by the city. The Department of Health says the disease is spread by a contact with an infected person or through contaminated food and drinking water sources.
We have our outreach or outbreak response teams, both from the provincial level and also the district level, including at the municipal level, that have then been dispatched since we learned of this outbreak. They've been dispatched to communities, affected communities that you mentioned earlier on, to engage with communities there in terms of getting obviously samples, but also to spread advocacy messages, because at the heart of this is also strengthening your public health education messages. The issues around the usage of safe water to drink, what people should do to treat their water to make sure that it's safe to drink, the issue of maintaining good hygiene in terms of washing your hands with soap and water before you handle any food, and even when you come from the bathroom, and how to just maintain those basic, including also ensuring that when you prepare your food, boil it, cook it well, and also peel what you eat or wash it thoroughly with clean water. Those are some of the tips that we are actually re-emphasizing, because from a health point of view, it's important that in terms of public health education, we keep on educating communities that us being able to keep a basic hygiene and also clean environments is contributes towards us being able to fight diseases or infections like the ones that we're currently dealing with.
All right, now let's discuss this. We are now joined via Zoom by Simphiwe Gada, DENOSA Gauteng Provincial Chairperson. Thank you so much for your time this afternoon. We now know, of course, that a 7th person has died from this disease. As DENOSA, how concerned are you about the latest outbreak, considering we have other outbreaks like measles, mumps, cholera, diphtheria, as well as malaria?
Well, thank you, and greetings to the viewers. Well, indeed, we are concerned. However, much as we are concerned, we think that the Department of Health, working together with the City of Tshwane, have got the finger on the pulse. There's been a response. We have been informed that there is samples that have been collected for analyzing in the labs, and we get the results so that we can be able to get a proper response and know how to treat these patients. However, one thing that we're grateful for is the fact that this, when it was picked up, the hospital was able to receive the sufficient support that it needed from the Department of Health. We have seen 2 spheres of government working together, that is the Gauteng Department of Health as well as the City of Tshwane. And today the MEC is visiting the area. So from where we're sitting, we think that healthcare practitioners are getting the assistance that they need. But what is more important is to get to the source as to what is the source. But what is concerning to us and what we think that should be given a more attention is the fact that this is not the first time that we're having a challenge, especially with water in that area of Hammanskraal. So something is definitely wrong there. And after these patients have been treated, we think that we should then take this thing further and do a proper investigation to determine what is wrong in that area with the water, because we've been having many challenges of water. You would recall in the past that water tankers had been dispatched in that building. The hospital itself at some point was having a challenge. So we think that the municipality has got to come out clearly if it's failing or is it succeeding in providing water, because water is one.
Simphiwe, can you hear me? All right, we seem to have lost Simphiwe Gada there. Of course, he is coming to us just basically responding to what we are currently dealing with now. Communities in Hammanskraal now being told, to refrain from drinking tap water following that diarrheal outbreak disease in the area that's killed. Now, we heard the 7th person has now died. Simphiwe, I think you are back. Can you hear me now?
Yes, I can hear you.
All right, Simphiwe, you are obviously touching on something very important, and that is the water issues in Hammanskraal. In fact, the SABC was there about 2 years ago doing a comprehensive analysis of what the situation in Hammanskraal is in as far as drinking water is concerned. We obviously understand that the Human Rights Commission also is investigating. What I want to know specifically is that now that residents have again been told, not to drink tap water, as a result of this outbreak, what impact will this then have on institutions, hospital institutions in the area, particularly as it also concerns your members and their ability to then conduct their work?
Well, it is quite worrying because you can never operate a hospital without water. Water is a basic need. I mean, if we talk of hand washing, we talk of infection control. You can never achieve proper infection control measures without water. So in between patients, our members have got to wash hands, doctors have got to wash hands. So that is why we're saying that we think that it's high time that we get to the bottom of the challenge. Because really, in a way, it's providing a negative practice environment for our members, and that is not what we want for our members. I mean, 28 years into democracy, we can't be having water challenges, especially, Hammanskraal belongs to the capital of this country. So this to us is also a disgrace on the part of the municipality. They should be concerned that we've got to talk about something so basic as water. But the call that we're making as DENOSA is that let's get to the bottom of this thing. And those who are responsible for this mess, they should be able to then answer. Because we cannot continue going on in this regard, because our members have been expected to go beyond the call of duty, in that where there are water tankers, we see our members going to collect water with buckets, carrying buckets, and that is an occupational hazard for our members. So this is a situation that we cannot tolerate, but because of the oath that our members have taken, our members have always put the patients first, even though these are non-nursing duties, these are non-clinical duties. So what we will be doing is to put more pressure so that the issue is resolved. But for now, we've been reassured that, the hospital is not that much affected, but we're yet to verify these reports. I will be in conversation with the CEO of the hospital just to check how far does the damage extend as far as the provision of services in that hospital. But from where we're sitting, the Department of Health has really responded, and we're quite happy that they are treating this as an emergency because it is urgent. I mean, one life lost is too many lives. So from where we're sitting, we'll keep putting pressure. And but more important is that those that have got more powers than us, such as the Premier of the province, the Human Rights Commission, even national government, we think that they should descend on that part of the country to get to the bottom of this thing, because it looks like it's a coordinated thing. We can't keep having a crisis of water in one area, as you are pointing out that you were there. Doing your own documentary around this crisis of water in that part of the town. So we cannot have that situation ongoing. So that is why we're saying that we have got to get to the bottom of this thing so that a solution that is developed should be a long-term solution, because currently we're just responding to a crisis.
Yeah, Simphiwe, let me come in there.
We want a long-term solution.
All right, Simphiwe, let me come in here. I mean, you talked about the test results, of course, that are being conducted. We understand these will be, the results will then come out on Wednesday. We also understand that currently a team is investigating, the source, as you've rightfully pointed out, and the extent of this outbreak. But should the situation be worse, than what is currently reported, what impact will this have on the already strained healthcare center in Gauteng, as you've also indicated, because this is likely going to spread to other regions of the province?
Well, we think that the disaster response team at the moment should be developing a plan. We'll also be pushing that there should be a plan. The manner in which we function in terms of dealing with health challenges in the province is that obviously other patients should be stepped down to other facilities. I mean, Jubilee Hospital is a district hospital. So we then look at the option of ensuring that patients are transferred to other facilities. And then staff also, if then there's more staff that is needed, of course, in consultation with us, then we should look at the possibility of redeploying some of the staff to other areas so that we can be able to cope. But our wish is that this thing must be contained, and we're confident that if we do the correct things, then the situation should be contained, because at least it has been isolated currently to that part of the district in Tshwane. So other parts so far we have not had anything, because we've checked since this thing broke out. So we're hoping that we can be able to contain it, but through consultation and open dialogue we should be able to then resolve this issue. But at the center is that as we protect communities, we are going to guard that there are no violations as far as the rights of workers are concerned.
All right, Simphiwe, thank you so much for your time. Let's leave it there for now. That's DENOSA's Simphiwe Gada, of course, responding to this latest outbreak, a diarrheal disease outbreak in the Hammanskraal area. Of course, we now understand that 7 people have died, 67 others have been treated at Jubilee District Hospital. People in Hammanskraal as well as surrounds and Pretoria being warned there that to refrain from drinking tap water.